Good afternoon, everyone. I am Dr. Jubin, PG Resident, Department of Ophthalmology, UCMS. I am going to present a case on bilateral optic neuritis post-Covid-19 vaccination. Uh, a 15-year-old female presented to eye emergency with 2 days history of acute loss of vision in both eyes. There is no history of ocular trauma, systemic illness, no history of Covid-19. There is history of Covid-19 vaccination 2 days prior to the onset of symptoms. General and systemic examination within normal limits. On ocular examination, vision in the right eye is PL positive, PR accurate. Left eye, hand movement close to the face, PR accurate. Color vision, both eyes appreciate shades of gray and black. On Hirschberg test, approximately 10 degrees left divergent squint. Pupil, both eyes round and regular, mid dilated and sluggishly reacting. Fundus examination shows in right eye nasal blurring of the optic dispersion and left eye myelinated nerve fiber around the disc. Rest ocular examination within normal limits. Routine investigation within normal limits. Inflammatory markers within normal limits. Torch, HIV, hepatitis B, C, VDRL, they are non-reactive. Chest X-ray within normal limits. CECT brain with orbit done, which shows ill-defined hypodensities in bilateral capsula externa. Optic nerves appear normal. Pediatric and neurology consultation was done, and pediatric consultation within normal limits, and neurology consultation they advised to start IV steroids. CE MRI brain with orbit done, which shows gliosis in bilateral capsuloganglionic region with enhanced nodule along it. Optic nerves appears absolutely normal, and CMRI spine is also done, which is also within normal limits. So our provisional diagnosis is bilateral optic neuritis post COVID-19 vaccination, and possible differential diagnosis were neuromyelitis optica optic neuritis or multiple sclerosis associated optic neuritis. In treatment, we started injection methyl prednisolone 1 gram IV OD for 3 days, followed by oral prednisolone 40 mg with tapering dose for 11 days. So course of the disease. So there is an improvement of the vision with decreased disc edema noticed 4 to 5 days after the starting of the steroids. So after 4 to 5 days, vision in the right eye is finger counting 3 meter, PR accurate, left eye finger counting at 1 meter, and PR accurate. Pupil brisk reaction in both eyes. However, patient started developing slurring of speech and altered behavior 10 days following initiation of the steroids. So the repeated neurology referral was done, and they advised anti-MOG and NMO antibody test and CSF examination were advised. Systemic steroids again increased to 40 mg daily. However, patient deteriorated further and was transferred to neurology for further investigation and management in IBAS hospital. So under them, CSF study was done, which is within normal limits, NMO antibody test within normal limits, and patient refused for the MOG antibody test. And a further course of IV methyl prednisolone was given for 3 weeks by a neurologist, and followed by oral steroid, which were tapered very gradually. So after 6 months follow-up, vision in the right eye improved to 6/24, in left eye improved to finger counting at 3 meter, and PR was accurate. Color vision normal in both eyes, pupil reaction normal in both eyes, and in fundus shows there is a resolved disc edema in the right eye with disc pallor, and in left eye there is myelinated nerve fiber around the disc. At 9 months follow-up, vision in right eye improved to 6/12, and left eye 6/24, rest same. So the COVID-19 vaccination, like any other, can cause side effects, mostly low-grade fever or muscle aches, and rarely neurological ones. According to vaccine adverse event reporting system, since the vaccination was developed, there has been 58 cases of optic neuritis reported worldwide between January 1 and June 30, 2021. 3 cases reported in India, all were adult and unilateral. Post-vaccine optic neuritis is a known but uncommon side effect where the exact mechanism remain unknown. Mostly believe that the vaccine activates the host immune system, leading to T cell activation, which damages the myelin sheath of the optic nerve. In the present case, the COVID-19 vaccination presumably triggered an autoimmune response and bilateral optic neuritis, which it is difficult to prove the association with the causation of the vaccines. And conclusion, ocular side effect of COVID-19 vaccination till date are ill-defined and poorly understood. Our case is rare, in which both CNS and optic nerve is involved, which responded to long-term steroid therapy. Thank you.
Yes, nice. So that's what we discussed just before this, that these vaccinations, though I mean I've not heard so much with Covaxin, it is probably a little more common, and these are just observation, we don't know really, we don't have enough data, that it is probably a little more common with Covishield. or with infection itself, and it can trigger variety of these optic nerve related problem or CNS related problem, and we should be on the lookout.
The mechanism behind it, did you look up or anything? Why the vaccination should result in a lesion, a problem like this?
Sir, because it activates a host immune response, sir, like the cross antigens, sir.
Right, absolutely. So exactly what, so all vaccinations have inherent among them an attempt to stimulate the body's response to an antigen. While the aim is to give this as an adjuvant because you are giving an antigen to which you want the antibody response, but that stimulation can be across the board. So this is a possibility that is being suggested, that these patients may be susceptible to getting this disease, however do not get it and may not ever get it in their lifetime, because the amount of antibody circulation is very less and there is nothing to trigger. But this stimulation, general broad stimulation of this, may give rise to a potential likelihood. So that is, I mean, besides of course the other mechanisms by which COVID can act, the vaccination is the increased likelihood, or the reports could be possibly because of this. But again, these are areas which are grey and we're not so sure. So, any comments? And then,
of course, it's very difficult. Though we assuming only there is a Dr. Gandhi. Is there anything? Can we prove it by any method? Anything?
confirm that it is
confirmed
post-vaccination.
Very difficult. I mean, both COVID and vaccination, there is, it is only the temporal relationship that you gave, there is an infection within few weeks, or you gave a vaccination within a few days. The event started, and because it is known, I mean, it is known that it can happen, but there is no way to say that cause and effect at the moment.
Yes. Or it may be due to the with COVID itself. Subclinical COVID earlier, maybe in unknown patient, maybe one of them.